So let's get started. Welcome everyone to the virtual conference brought to you by Gay City News. We're thrilled to bring you the Rising to the Challenge nonprofit in the age of COVID. We look forward to a valuable discussion today, and I'd like to thank our sponsors for making this possible. I'd like to thank Metro Plus Health, AARP New York City Health and Hospitals Kings County, Apacha Community Health Center, and the AIDS Healthcare Foundation. We're going to hear a few words from our sponsors, and then we'll get started. Starting with Metro Plus Health. Since 1985, Metro Plus Health Plan has built a reputation for providing access to affordable, quality health care to the people of New York City. A wholly owned subsidiary of New York City Health and Hospitals, the largest municipal health system in the United States, Metro Plus is the plan of choice for over 500,000 New Yorkers. As Metro Plus has grown, so has their commitment to offering medical, psychological, and well-being services. Learn more at metroplus.org. And stay with us for a moment for a video. Thank you for that. Next up, thank you to AARP New York. Pride is truly ageless. That's why AARP in New York City.
That person's going to be like, this is exactly what I want. So if you think about some of these ideas, you're like, how do they come to be? And it is so specific. Frozen yogurt treats for dogs. I was just looking at this guy who rents out cars he doesn't own, somebody who's
I apologize. We had a little YouTube intrusion. I'm sure that's happened to some people before, never to me. So I do apologize. Let me get back to more important things. AARP New York. So let me start again. Price is truly ageless. That's why AARP in New York City was thrilled to support this important conference. It's crucial time to come together and care for one another, even if we have to do so virtually. And AARP is here in New York City to help. They're offering AARP Community Connections, a new online platform where people can find mutual aid groups that can help neighbors stay in touch without leaving home. If you need to hear a friendly voice, sign up to receive a phone call from a trained AARP volunteer. And if you want to give back, you can even start an LGBTQ group in your borough. On the phone or online, AARP is here in New York City to help. Visit aarp.org/NYC to learn more about their support of the LGBT community. That's aarp.org/New York City, NYC. Next up, we have a video from New York City Health and Hospitals, Kings Center. Bear with me one moment.
Hi, I'm Dr. Roque Streamer. Get that checkup you've been putting off and make your appointment today.
I'm Dr. Neely. Make that appointment. Our care team is excited to see you again. Monsieur Docteur Marie-Nicole Dumas, Company, mettez rendez-vous. Personnel de santé à content encore. Merci.
Hi, I'm Dr. Melissa Wade. We are ready and waiting to provide New Yorkers with excellent care, just like we always do.
Call 844-NYC for NYC to learn more.
Thank you so much for that. Next up, we'd like to thank Apacha Community Health Center. It's a proud sponsor of today's conference. Aperture is committed to being a medical home for new and existing patients during this difficult time. Aperture can help you manage and maintain your health in order to stay out of the hospital, emergency room, and urgent care centers, and to keep those you love safe. They can help you with at-home HIV testing, help you start PrEP, or help with SNAP and insurance applications. Aperture is offering telemedicine visits with their doctors, which allow you to have a face-to-face video appointment with your provider using the camera of your mobile phone, computer, or tablet. And your telemedicine visit will be secure and HIPAA protected. To schedule a telemedicine visit, call Aperture at 212-334-6029 or send a message through the patient portal. An Aperture patient associate will follow up with you and assist you in scheduling a telemedicine visit. Stay healthy with Aperture CHC. Visit them at aperture.org. And last but not least, we'd like to thank the AIDS Healthcare Foundation. They are currently the largest provider of HIV/AIDS medical care in the world. AHF funds its mission to rid the world of AIDS through a network of healthcare contracts and other strategic partnerships. Generating new, innovative ways of treatment, prevention, and advocacy has been the hallmark of their success. They can be reached at aidshealth.org. We'll be sure to make sure that you have all the information about our sponsors as well. And at this time, I'd love to turn it over to Editor-in-Chief of Gay City News, Paul Schindler. Thank you so much.
Thank you, Elizabeth. As we close out what I think for many of us has been an unusual Pride Month, we felt it was important for us to talk about the impact of the COVID pandemic on how our vital LGBTQ nonprofits here in New York have been able to operate, how they've been able to adapt, what they've experienced in terms of demand for their services, and what we can learn from this experience for the future. I'd like to get right to introducing our panel. Alex Roque served for 9 years as development director before this year becoming president and executive director of the Forney Center, which serves homeless LGBTQ youth across the 5 boroughs since 2002. Carmen Neely was a co-founder and it serves as president of Harlem Pride. Floyd Rumohr is the chief executive officer of the Brooklyn Community Pride Center. Sean Coleman is the executive director of Destination Tomorrow, the Bronx LGBTQ Center. Emmett Finley is the communications director for God's Love We Deliver, which since 1985 has prepared and delivered meals to homebound people living with serious chronic health challenges. Inaku Mushavik is the executive director of the Movement Advancement Project, which provides research and strategic direction to hundreds of nonprofits and thousands of businesses that work in the LGBTQ space. I'd like to get right to the questions and first tackle the question of how the operation of nonprofits has been impacted, impaired during the restrictions on all of our lives during the pandemic, and also how you've all adapted. And Floyd, this is a conversation that you and I actually started a couple of months ago when you first talked to me about what the Brooklyn Community Pride Center was going through. Can you give us a quick sense of the constraints that you faced?
Yeah, the big one was we're in the people business. So a core value of ours is people first. We interact with people, we serve people. Face-to-face interactions are very important to us. So when CV-19 first hit, we weren't sure how we were going to adapt to that. But we knew we had to do it online so that we could advise pause restrictions. And the interesting thing about adapting to that new environment was that we were already set up pretty much to do virtual programming. Most of our infrastructure is online anyway. So we pivoted within days, actually, thanks to our director of programs and the program team, Jaco Douglas Boren. Within days, we were up and running with everything from AA groups to transgender and gender non-conforming support groups.
Now, these were groups that primarily had been meeting in person in the community center?
Yes, they had only been meeting in person up until that time.
Okay.
And the fascinating thing that we saw was that hundreds of more people were interested in attending these activities once they went virtual. We don't entirely have the reason for that yet because we haven't studied it, but we think it's because proximity, people don't have to travel as far. There are other barriers like some people prefer anonymity. Mm-hmm. So that I think has really bolstered some of our numbers.
So Brooklyn is a large borough. Travel time to where you are may be great for people in other parts of the borough, and you can also serve people from outside the borough. Is all of that at play? That
is all at play. In fact, some of our young people in Pride Path Workforce Development come from the Bronx and other boroughs, some even from New Jersey.
Right.
And shifting that program, particularly online, to online internships and training has been particularly beneficial for them.
Okay, Sean, you play a very similar role in the Bronx to what Floyd does in Brooklyn. How did your experience go in terms of shifting?
It was similar to Floyd's, right? We had the infrastructure in place that we could take many of our programs and services virtual, but myself and two of my employees, both of my directors actually came down with COVID-like symptoms. So it complicated the process as we were trying to pivot into this digital world now. We ran into the complication of the three top folks in the organization not being readily accessible to actually make the shift. We did it. It took a lot, but we were able to accomplish it. One of the things that we noticed is that some of our core members were unable to attend the groups because they didn't have either the equipment or internet access. So that became an increasing problem for us to make sure that folks that wanted to attend these groups had the means to do so. Particularly with our GED program, we shifted and went to a Google Classroom, but I believe it was like maybe 20% of the class was not able to attend because they didn't have equipment and or the internet. So that was one of the things we shifted to. We are actually reopening now. As of last week, we reopened on a limited schedule. So what we're doing is we're doing HIV testing by appointment and we're doing intakes by appointment, and we're going to keep the other programs operating virtually. One of the things that we're noticing is clients are now, those folks that were dealing with maybe depression or anxiety, they're really having a hard way. And we are guessing that is the reason that more people are attending groups, because as Floyd said, it's easier now, right? Whereas you may have had that you may have been self-conscious about stepping into a new environment or stepping in front of folks and expressing yourself. Being behind the computer gives you the opportunity to pop in and pop out as you need if you're uncomfortable. So we have also seen an increase. What we would like to do with opening on a limited schedule is figure out a way that we can do some of our peer-on-peer counseling in person for those clients that are having a really difficult time with anxiety and bouts of depression and social isolation.
Yeah, Sean, you touched on something there, and I'm curious about this. How much of a barrier is either lack of access to computer equipment that people can plug into your services, or knowledge limitations of how the computer services work? How much of a barrier was that for your clients?
A huge barrier, especially with many of our clients being either homeless or couch surfing. Just simple access was an issue for them. One of the other things that they've presented, we started a COVID fund because we had so many clients coming in asking, reaching out to us to help them with bills that we wouldn't have thought of before, right? They wanted help with their cable bills or with their phone bills so that they can keep access to the limited services that they had for those that had them. And then I guess one of the biggest barriers, many folks don't know how to access some of these programs. So you may tell them to go to a Zoom call and they have no idea how to join a Zoom group, right? So that was also a barrier.
And give me a sense, you talked about some of your top people there experiencing COVID themselves and being out of play for a time. How big a staff are you talking about to get an understanding of how much that blew you out of the water?
It's only 10 of us.
10 of you, so you lost 30%.
Yeah, we hustling hard. It's only 10 of us.
Right, okay. Carmen, you serve the community in a different sort of way than Floyd and Sean do. You're not a brick and mortar operation. You're really, your organization brings people together for celebration and other kinds of markings of pride. What has been the impact on Harlem Pride this year, and how have you adapted to keep the spirit of togetherness that the event creates going?
Thank you, Paul, and thank you for having me. Definitely, COVID-19 had a major impact on us. We are a volunteer board, and so as such, we were able to basically just work from home. We all fortunately have access and we're able to use Zoom for our meetings. What really impacted us, we had various events going on at different restaurants or bars in the neighborhood, and that had to shut down, as well as our main event, our Harlem Pride Celebration Day, which last year garnered about 20,000 people with the help of World Pride. We had to cancel that, and we actually canceled before the city shut down those large events. And in terms of working from home, that was fine. That was an easy pivot. But how would we recreate the essence of Pride became a major challenge. What we ended up doing was the one event that we were holding on to leading up into Pride, our show out, we turned it into Show Out Digital, moved to a space where it was just the performers and the camera crew and the director, shot some work that we later premiered on our website and on social media. And then we also created a digital hub where we recreated the sort of community that we would normally see out in 12th Avenue for our festival day. And we brought that online. So we were able to pivot, but it was definitely a challenge because it's really hard to replace that in-person feel. A lot of people talk about our Harlem Pride events as a family reunion. And we like that idea that it's got that feel of getting to see people you don't normally see every day, and you know, people looking forward to that annual event. So those were the major challenges. We also had a few challenges where members of our family, of the board members, had COVID-19 and personal challenges along that line that would call for someone to be absent or, you know, call in or just get the notes. But in terms of our meeting, we were able to do that. Our office, we actually closed it down fairly early.
Right.
So that was a benefit to us individually in terms of we were able to quarantine much earlier than the city did. I think our last event was March 12th, which was a Wednesday, if I'm correct. And by that Friday, we were all self-quarantining. So it's been a long haul with lots of challenges, but basically those were the ways we were able to pivot.
And I assume those restaurant events and so forth that you mentioned are they primarily fundraising events to pay for the bigger celebration? Is that one of the functions of those events?
No, actually, they are basically to showcase the talent.
Okay.
What we had was something similar to American Idol, and we called it Show Out, and where we had performers competing in different categories. And then the winners would be on the main stage.
I see.
So our stage became the digital stage of our website and our social media networks. We had planned a fundraiser, but we did not do the fundraiser given that the venue would not be available.
Right.
And we haven't really replaced that, but thank goodness we have a great treasurer who's kept our books really nice and tight. And in terms of paying bills and that sort of thing, we're good. We are at a bit of a deficit into the normal budget we have in planning for the next year. Mm-hmm. And so we'll have to deal with not having quite as much in the bank, so to speak, that we usually have when going forward. But I think we'll just have an adjustment. The other challenge is as we go into post-Pride month, which is the beginning of our planning, we have a wrap-up meeting tomorrow, actually. And then we have our annual board retreat where a great deal of our planning takes place. We're just not sure what to plan for. We doubt that next year will allow us to have our typical celebrations, but we just don't really know what to expect, and it's hard to predict. So I think we're gonna try to plan for both and see what happens.
Were you satisfied with the outreach and with the reach that you were able to have with the virtual hub and those activities? I mean, did you feel as though you were attracting the community and gathering that kind of family feeling that way?
Not when it pertained to the direct website, but I think with social media, we were pretty much happy with what we got. It was hard to gauge. We have definitely in our social media networks, we have what we typically have and a little bit more. On the website, traffic increased, but not to the degree that we had hoped it would with regard to the hub.
Right.
But I think the concept is perhaps new because essentially it's like our own little Facebook network, a closed network. And when you have Facebook being what it is, you could go to one place and it's like one-stop shopping. The adoption to another platform is really slow. And I think, that caught us up, but we wanted to provide that. If people want to go check it out, it's hub.harlempride.org. And the basic thing that's really there, you can find a lot of COVID-19 resources from the WHO, CDC, all the way down to the mayor's office and different borough president offices. So the information is definitely there. We were happy to provide a central location for that. So we think that was the most useful part. Sort of the community feel didn't quite reach what we wanted, but we still have that in our social network platforms.
Right. Alex, when I go to the Ali Forney website, the first banner I see is that we can't close, we're their home. So tell me about how an organization that both provides social services but also provides housing for your clients. How did you maneuver that?
It was incredibly challenging, and thank you again for the opportunity to tell our story and for the work to raise awareness of organizations like ours. It was incredibly challenging to do this work and to understand that around the world, and especially across our country, we've been hearing messages of stay home, find safety, find comfort. And for our young people, that option of home, that comfort at home, that safety of home does not exist. And in many cases, and in all cases, it's a re-traumatizing of their experiences as a reminder of how much they have lost and how much they've been denied because of their identity. And for us, as the logistical challenges, I'll tell you more about that, but for us, the most critical and the most immediate challenge was the trauma associated with it. The Ali Forney Center operates 18 sites throughout New York City. We are open 24 hours a day, 7 days a week, 365 days a year. Our doors do not close. We do not have the option of asking our young people to call back later. And we really first and foremost dealt with mental health crisis, trauma, both among our young people and also among our staff. There was a very delicate balance of providing safety and comfort and care for our young people, but also safety, comfort, and care for our staff. And what young people felt comfortable with, what staff felt comfortable with, even today as we move into different phases, has been incredibly challenging. Like my other panelists who are sharing some incredible stories and some just similar parallels to what we experienced with our kids, there has been a 60% increase in online engagement in mental health services at AFC, 25% engagement in substance use services, and a 35% engagement in just crisis care. There's also been a whole other world of community building. All of our work, I think, on all the panelists share the work that and generally our movement, right, is to not be isolated. Our movement is to build community, is to come together. And as we evolved through the pandemic, one of the things that we did is try to figure out how to build community remotely. So we launched a virtual engagement program. We had Amazon wish lists for each of our sites where people can have can fulfill requests of board games and video games and tablets. And also we had a virtual pen pal program and more of an online engagement with the community. So we got really creative, but it wasn't without its incredible challenges. One unique thing that we did very early on is launch a task force of agency leadership that met several times a week and addressed the different moving pieces and the constantly changing information of COVID. And then once we stabilized, we actually looked around us and found that a number of providers had been closing their doors for a number of reasons. And we actually partnered with the city on running a hotel for convalescent youth, not just LGBT, but all convalescent youth, and really got that program off the ground. But it's been a whirlwind of a time.
Now, your drop-in center, did that have to close, or did you keep that open?
We followed CDC guidelines in that they actually said that being in the drop-in center would actually become a hotbed of spread, if you will. So what we did is we mitigated those services to another site. So we still had drop-in services, but it was at one of our housing sites, which is more contained, and we were able to segregate and really channel services differently. So we did unfortunately have that shift, but we were still able to offer those drop-in services at a location that clients were familiar with and able to access.
So youth who needed that opportunity to go be someplace, you were able to accommodate them in a different way.
To access a meal, to speak to someone in crisis if they were in crisis, to more importantly get a housing referral, and also to access medical mental health services. Right. COVID and COVID related and not COVID related. Also for young people who are actively homeless or unstably housed, helping with continuation of any home and replacement therapy or of any other critical care services or gender affirming services, which is for us as obviously for our community as vital and as critical.
And just remind us, approximately how many youth do you actually house kind of on an average night?
We have 157 beds throughout our housing sites. We then have a 24-hour drop-in center that would typically house would offer 20 overnight programming for 24 young people. And on average, we see over 2,000 homeless young people a year, at least our 2019 numbers. Yeah.
Wow. And Emmett, you folks, you might want to, you folks prepare a lot of meals and deliver them to homebound New Yorkers. Actually, I believe in the sort of the metro area as well.
Yes. Mm-hmm.
First of all, how many meals are we talking about daily?
So nowadays, during COVID, we've actually reached over 10,000 meals a day.
Okay.
And just to our service area, we serve all 5 boroughs of New York City, and then parts of Westchester, Nassau, Hudson County, New Jersey, and Suffolk County. So it's a big distribution area as well.
So, I mean, the first challenge is you actually prepare the meals. These are not meals that you're getting from someone and you deliver. So you have an enormous kitchen, professional kitchen operation. You must have had to exercise new regulations on how those people interacted with each other, I assume. Is that correct?
Oh, absolutely. So, I mean, COVID-19, just like everybody here, and it's been a real pleasure listening to all of you and the phenomenal work your organizations are doing. At God's Love, COVID flipped everything upside down. So we were deemed an essential service provider. So that meant we could keep cooking and keep delivering. But of course, with social distancing measures, we had to figure out how to not only keep our meal output going, but increase it because we were receiving such an outpouring of requests for service from folks, how to increase those meal numbers while working with an actually decreased volunteer force. Right. And the reason the volunteer force decreased is, at first, everybody was told to stay at home. And so we rely on a huge corporate volunteer base, and those folks were asked to work from home. So we no longer had their specific volunteer shifts. But also a lot of our long-term volunteers tend to be older, which just means that they understandably have been staying at home to keep themselves well and to not put themselves at risk. So we originally lost a lot of volunteers, and then we gained volunteers who sort of reconfigured their lives and what they were able to do. And so they came in, but we had to decrease the number of volunteers on shifts just so that we could socially distance across the board. So we're working with fewer folks in the kitchen and in meal kit assembly, but we've still got to deliver 10,000 meals a day.
Now, how many volunteers is on average in a week's time does God's Love have involved in order to make your operation possible?
So we're grateful to report that we work with 17,000 volunteers in a year. In a day, pre-COVID, it was averaging out to maybe 250, 300 volunteers, depending on the day.
Right.
But now with COVID, we've reduced our volunteer force by about 60%. So, you know, that math.
Right. And the number, you said you went up to 10,000 meals. What had the run rate prior to COVID been?
Yeah, it was about 8,600 meals daily. So we saw immediately an increase of about 25% in terms of both client number and meal number. But then the volume of calls we were receiving was about increased about fivefold from what it normally is. And understandably, people are scared, people need food, people are at home, they're isolated, and they reached out to God's Love for help.
Yeah. And one of the things I've always heard about your delivery system is that for many of your clients, just that brief interaction with the person delivering the food can be very meaningful to the client, and obviously that had to change. How did that work?
Right. You know, the meal delivery is really meaningful for both the client and the delivery folks. There's that one-on-one conversation and communication. So we've actually instituted no contact delivery. So many of us at home have probably experienced that with an Amazon or a FedEx or a UPS. Right. But at God's Love We Deliver, when our clients are really looking forward to that delivery, we wanted to make sure that while it followed COVID-19 protocol, it also maintained the heart at God's Love We Deliver. So a no contact delivery looks like a driver calling the client a little bit ahead just to say, I'm coming, you know, please be ready. And then at the door, the driver will drop off the meal at the door, they'll knock, and then they'll walk away. And they'll wait for the client to open the door and make sure that they've seen that client actually receive the meal. But so that, you know, of course they step back six feet or more, but that they're able to give that wave and say hello and really just check in and make sure everything's all right.
Is checking in part of, I mean, if a client doesn't respond, is that something that God's Love will take an action on? You know, that this person is not home or not responsive?
Yeah, we like to say our drivers are our the front line real contact with our clients. If a client's not home, we make sure that we call that into the database or to our headquarters and make sure that a client services rep can call, you know, and we'll make sure that we try delivery again. And, you know, sometimes we hear from folks, oh, I was just in the living room and I didn't hear the doorbell. For other folks, it's something more serious, and we make sure to stay in touch.
It's a form of wellness check.
Yeah.
Enika, I first of all want to apologize. My brain froze when I said your name earlier. So I hate to mispronounce folks' names. What are you folks hearing from the sort of the vast number of organizations that are part of your coalition in terms of the LGBT community's needs and services being constrained as a result of what's happened across the country?
Yeah, I mean, it's really tough out there. I mean, I want to start with just saying I am so in admiration of my fellow panelists right now, and just the amount of innovation and work and the amount of thinking that has to go in to adapt to this new environment. And that is what we are hearing across the board, not just from direct services organizations, but also from advocacy organizations. Centerlink actually did a very quick survey of community centers to see how they were responding to the COVID-19 crisis. And we're hearing a lot of these types of trends, increased demand for services and types of support. I think mental health services, physical health services, people are feeling isolated, so they're reaching out because they want community. There's dealing with disruption of services and supplies. So, you know, you might not be able to get the food delivery you need, or your volunteer base is shrinking. That's increasing operational costs. And at the same time, what folks haven't talked about, but I'm sure they're all struggling with, is a decrease in revenue. So, you know, we're seeing reduction in revenue from individual donors, certainly from corporate sponsors, because they're all struggling at this moment, small businesses. And, you know, the panel here is in New York, but we've got about 250 odd community centers across the country. These really range from something like the LA Center, which is a multi-million-dollar community center. It's huge, to in some of these rural areas, a community center is really like one person half time with a mobile van. And so a lot of centers don't have any ability really to weather a storm like this, that if they continued operating at their current capacity, what the statistics is showing is that about a third of them would be out of business within a couple of months. So people are really having to adjust their operational styles as well. And it's really been a challenge, but at the same time, you know, the types of discussion we're having today, the staff, the executive directors, people are coming up with really innovative ways to meet the crisis. And I think when this all passes, and we don't know how long that will be, there are going to be a lot of really positive lessons learned, because especially in rural areas of the country and hostile areas of the country, being able to serve people remotely, first of all, means you can go to any community center for help. You could be in Alabama and go to the New York Center and join a group there if you wanted, which may be part of the increase in demand. But also, if you were isolated and you couldn't drive and you couldn't get those services, now there's more of a way to do that. So I think, you know, obviously a balance long-term will be good, but I also think that some of the innovation we're seeing is really helpful and is going to stick around with us in the long term.
You know, I do want to move over to that point about revenue and funding and fundraising and so forth. But before we do that, I'd just like to double back if anyone has any additional comments about the way in which they've understood that demand for their services has grown. What kind of indicators, any anecdotal sort of information? I mean, Floyd, I think in our last conversation, you know, you had suggested that, you know, folks who had never been connected to you before became connected. I'm wondering if others have those kinds of stories about, you know, people suddenly in a more vulnerable situation, actually for the first time finding out about some of you. Anyone want to jump in on that one?
Yeah, we've seen quite a bit there, Paul. An example is our relationship with Rocksteady Farm that we thought was going to be nominal at first has really exploded. On Thursdays, when they deliver their packages of vegetables and various food items, at the last visit, there were 30 pickups, and that's a lot more than we were expecting.
And that's a food pantry program?
It's not a food pantry. It's a subscription service where you can, if you want a box of food, have it delivered. And the Brooklyn Community Pride Center is one of the pickup places.
I see. Okay. Any other things you want to jump in, Emmett?
So at God's Love, we deliver, right? We cook and home deliver medically tailored meals to folks who are too sick to shop or cook for themselves. And understandably, when COVID-19 first happened, people who were perhaps not, you know, entirely food insecure started reaching out to us for help. Given that senior centers were closed down and that sort of thing. So we received this sort of flood of referrals and flood of requests for service. And we were actually able to sort of acquire that data when our team developed an eligibility screener. So what that means is you go through an if then that type thing. And, you know, if you qualify, you go this way and we start you on the program. But if you're not if you do not qualify for the program because you're not living with a severe illness that requires, you know, home delivered meal delivery, we, with like a loving hand and a kind heart will direct you to another food source in the city. So since we developed that eligibility screener, we've actually seen it used over 3,000 times. And about half of the people who have used the screener qualify for program. Okay. Which is great, but it also means that the other half of folks who don't qualify for program were able to direct to another food source in the city.
Okay, okay. Alex, you know, one of the things that I've wondered about you know, youth who have housing instability is that in, let's say, normal times, in times when there's not a health crisis, they may be able to do couch surfing. They may engage in sex work. They may be willing to ride a subway all night before they'll turn to services in terms of a formal shelter. Did you see an influx of people who otherwise might have had other options or taken other options?
You know, we haven't had any real consistent change related to COVID. The increase came from young people who were formerly living with us and had gone off to college. And when they were sent home, needed home, and we were home before they left. We saw an increase in young people or a shift in young people who were in unstably housed situations, who were now forced out of those unstably housed situations. But consistently, our numbers have remained rather the same. I think there's going to be a small dip in the numbers based on the fact that 45% of our kids come to us from outside of New York, and for some time, the New York was a place that was difficult to get to, and for a number of reasons, people didn't want to be here. So I think we'll see those numbers as we get through the month and look at that. But there hasn't been any like real specific trend.
When you say 45% from outside of New York, do you mean in the New York area, or do you mean from other parts of the country?
Other parts of the country. So 45% of our clients come to us from outside of the greater New York area, which we call New York, New Jersey, and Connecticut. So outside of that is where 45% of our clients come from. Okay. 50% from New York and the greater New York area, 45% from outside of that area, mostly the South, and 5% come to us from outside of the United States.
Okay, okay. And of course, I did want to turn to you know, a very critical issue, which is funding. There's fundraising. There's government revenue streams, state and local. There are philanthropic and your donor community. What have you seen in terms of, I guess let's first of all start with your donor and philanthropic community. What have folks seen there? I don't know to what degree each of your groups might depend on that kind of funding, but what have you seen there, and how much have you had to adjust your calculations in your budgeting?
For us at the Forney Center, we have certainly seen an incredible outpour of care and support. For a very consistent amount of time, it felt very dark and bleak, but there was also this contrast of the goodness that was in the world and how many people reached out and said, how can we help? And helping to brighten our days, if you will. And that really helped to offset the loss in some of the short-term individual giving that we would typically see throughout the year. Our biggest hits and what we're bracing for at the Forney Center is for a $1.5 to a $2 million loss, which is really substantial. And that's entirely in the private area or in the non-government area. And that's a number of events that have been canceled. We have our fashion show, our summer benefit, our Pride fundraising, and our marathon, and the marathon being canceled. And those are all, and that's not even counting our dinner, which is set to take place in November, which we know will likely be canceled. So we are bracing for a big impact.
So Alex, rough figure out of your overall budget with those kind of fundraising events, what kind of percentage of your overall budget does that represent?
So we're a $15.5 million organization, and we're looking roughly at a $1.5 to a $2 million loss. So largely half of our private. So our private is $5.5 million. So mostly half of our private.
Who else experienced problems in terms of major fundraisers that were lost? I guess Carmen, you had mentioned one that was where you were not able to hold and will impact what you do in 2021.
Right, right. We had planned somewhat of our first gala sort of thing, and we were all set to go. I mean, we had pretty much planned everything right up to March. It was just the marketing that was left.
Right.
And we had to cancel that. So the funds we expected from that, we won't actually get. We have had private donors step up and be very generous, but our biggest loss will come from sponsorships. We certainly didn't get as many sponsorships as we normally would because we didn't have the event in the way that we normally did. But we had quite a few of our solid sponsors who've been with us from the beginning and throughout the majority of our 11 years that came through with various options and packages that we were able to work with. So it's still a significant hit, but we definitely had some of our foundational income bolstered by those sponsors and the generous donations of our individual. And we have some private foundations that are definitely giving us a little more than they normally would because of the COVID-19 situation. So we're going to be okay, but we definitely have taken a hit.
But they haven't said we're going to have to pull back. Then they've actually said some of them were willing to step up for more.
Right, right. Some of them will give us a little more than we normally would receive.
Yeah, Sean, what have you seen in terms of both fundraising and private donors or philanthropic donors?
Well, this would have been the first year that we really were aggressive about fundraising, in that we would have had events. So last year we had Bronx Pride, and we were able to raise about $20,000 off of our share of the collaborative for Bronx Pride, and we were forecasting to have a gala in December, which we're going to cancel now, and we were forecasting that we would do about $40,000 on that. That doesn't hurt us as bad because it's not money that we would have gotten ordinarily. I think the biggest obstacle for us has been the way payments happen with the government, and that we haven't gotten with the discretionary funding, you voucher for it and then you sit and wait, and we've been waiting since March. So that's been one of the biggest issues for us. We've had really, really good luck with foundations and corporations, though. They've actually stepped up and given, handsomely. We've just gotten a donation from Dove. We got a donation from Equinox. Robin Hood Foundation came on board and helped us out with some money. So because of those donations, we were able to kind of plug in the gap that we would have gotten from that forecasted fundraising, from those forecasted fundraising events. But overall, government funding we're about 60% in with government funding, and expect to get a hit probably today or tomorrow. We'll find out about the hit that we're all going to take. So bracing for that hit and trying to figure out if now we can kind of restructure what that fundraising plan we had looks like, and do some of it digitally.
Yeah. The government funding, the government contracts that you have, are those primarily city as opposed to state contracts?
City and state.
Oh, city and state. So have you seen any cuts yet in terms of the state funding?
Now, the state, actually, we were on a 5-year, a multi-year grant, and they haven't cut any of it. But yeah, they haven't cut any of it. Don't put it in the air. Yeah, we'll keep it that way.
And I saw you shaking your head, Emmett, first about, I guess, private giving, but then also, again, about government funding. What's the situation at God's Love?
I should be watching myself in the video. I'm not sure what I'm doing. So at God's Love, just like Alex was talking about at Ali Forney, we've been very fortunate to have a real outpouring of support from folks across the board. So at God's Love We Deliver, we're sort of like the flip of Sean's organization, and we generate the majority of our fundraising comes from private donors, and then a smaller portion comes from government. Our costs to date have increased by about $1 million from COVID, based on, renting vans so that we can deliver, hiring temporary staff so that we can make those deliveries, new equipment so staff can go remote, that sort of thing. And with the huge influx of clients on program, we're looking at anywhere between 7 and 8 million throughout the year, and an increase in expense just to meet the just to deliver to those new folks. But with that great support from people, we have we've seen great in-kind support from local restaurants who are closing down, who wanted to give us their veggies, and we took it all, I'll tell you that. Right. You know, our digital fundraising has done extremely well. People just found us online and gave to our COVID fundraising. Corporations and foundations have been very generous. And that's been really wonderful. And, you know, from the government, we've gotten about 2 million from the city and 1.3 million from PPP. So that feels really good. But we are concerned, of course, as we look ahead to the rest of the year with this huge influx of folks on program, you know, how much money we're going to need who's going to stay on program, and how much money we're going to need to make sure that we can deliver. So
the city budget today, are you waiting to find out how that will affect you, or do you have a contract in place already there?
I'm going to have to talk to my policy folks on that.
Okay. I you know, it's brand new. In fact, the council has not even voted on it. Floyd, what's been your experience?
Well, similar to Alex and Emmett's, we've seen an uptick in individual giving, sort of an outpour of goodwill during these times, but we've seen a downward trend in corporate giving, and that's largely due to the cancellation of our 2020 Community Leadership Awards and Gala.
Right.
That's usually our big event annually, and we've had to cancel or sort of repurpose it. We did an event with Poppy Juice last Friday, but that wasn't a fundraiser. That was more actually a sponsorship that we did for the Chris Queer Fund, sponsoring the Poppy Juice event to support them in their time of need. We've seen foundations remain about stable, and government income, which is 57% of our annual budget, is currently stable. The city is delivering on their FY20 contract, which ends today, but FY21 begins tomorrow. And we're all, of course, waiting with bated breath to see what happens to our budget.
Yeah, roughly how long after the budget is approved do you get down to the line items that you're concerned about and understand what you're going to be seeing? Is that a couple of week process? Or
well, it usually comes out by mid-June. The Schedule C comes out, and we can go in there and see what the city council discretionary what the city council has done, what each member has done, and then also it lists initiatives. And we receive funding about $500,000 a year from the LGBTQ initiative.
Right.
And I'm hopeful that the city council will see the wisdom of supporting that, given the thousands of people that we serve through that initiative annually.
Yeah. You know, I think that I first became familiar with Movement Advancement Project back at the time of the 2008-2009 financial crisis. And I remember some reports that had come out at that time. You know, do you folks have any idea about how this current situation compares to that? And are there lessons that we can draw from there to see how people can sort of patch some of the holes that are appearing?
Yeah, I would say not yet, that we don't know the comparison yet. Most of the folks that we're talking to are actually more worried about 2021 than they're worried about 2020. And part of the question is, how long is the pandemic going to last? How deeply is it going to affect people's pocketbooks? I think the projected losses this year are not as big as most organizations were expecting, and it really depends on what your organization looks like. Like, a lot of the advocacy organizations are able to make up costs because they're cutting travel, which community centers, they're not cutting travel because it's all local. Right. So there's some ways in which, you know, folks are able to do a little bit of check and balance right now. But the question is just the uncertainty and how long this is going to last. I know a lot of organizations got the PPP loan from the government, and that's tiding them through this year. You know, whether there's going to be another one of those next year, it's kind of unlikely. But yeah, the big hits are event income. You know, it's pretty much, people are doing online events. They're having some success, but not amazing success. Corporate giving is a big area. Individual donations have been kind of fluctuating. I think it depends where you are and what your programmatic services look like. A lot of community centers actually have, fee for services and programmatic income, and they're seeing a huge drop in that. So we don't know. We're very concerned because our view is that we're in for a tough winter. And as as folks continue to maybe see that we don't have this economic reopening, the kind of generosity we're seeing now for a lot of people just simply may not be possible. And so a lot of the organizations that we're working with are really trying to plan worst case, and they're doing multiple budget scenarios for how do we adapt if things aren't turning around, or if this is a 2-year thing instead of a 6-month thing.
Right. Here in New York, we seemingly went through the worst of it possible, and I think in some people's minds it was a fading thing, and now we're every day reading in the paper about the tremendous rise elsewhere in the country. And I think the leadership here in New York, and I think the residents here have been very supportive of trying to reopen in the right way, but it's very hard to think that we will not have another round of this at some point. And I think Carmen, suggested that a big pride event in Harlem next summer may not be feasible. And that's 2 years then, not 1 year. And the impact on the building of community, which is what so many of these groups are really all about, can be very profound. Alex, I know that over the years, your predecessor and you fought very hard each year with the city council to try to make permanent funding streams for beds for homeless youth. How much is at stake down at City Hall today for you guys?
I have this debilitating superpower of being a helpless or hopeful optimist. And I've had a series of conversations with our city agencies. I think that our fight over the past decade, and so many of you on this panel have joined that fight, has really solidified for the city that homeless LGBTQ youth are at the outskirts of the outskirts and largely underserved and underrepresented in any systems and government and funding and care, and that New York City has a responsibility to this population. So I am hopeful that our budgets will remain intact as it relates to homeless youth programs. And I am hopeful for other programs that the hits that they take are not as substantial as it seems that they may be. There's, one, outside of the fight and how frustrating things have been in New York City, I cannot imagine being anywhere but in New York City doing this work. I cannot imagine being in any other city, in any other state, or even in any other, well, maybe another country. But having to be in the United States, could you imagine being anywhere else and having to fight and having to be this visible and having to be this centered and represented? And that's kind of the hope and that keeps me going every day, understanding that we are in a very unique place for a number of reasons.
Well, I mean, that was a fight and a prominence at Ali Forney year after year after year after year. I mean, you're, what, 18 years old now, the organization?
That's correct.
And, it was really well into Mayor Bloomberg's third term that the basic principle of, holding the program equal each year and trying to grow it was still being fought about. And what is your sense of, I know I talked to Carl a lot over the years about this, about what the unmet need was for beds. Where is the city right now in terms of availability of beds for homeless youth?
There's still a lot of work to be done. When we launched the campaign, and other members on this panel who co-signed the campaign and were part of the campaign for Youth Shelter, really had a demand that the city add 100 beds a year to homeless youth programs until they're no longer waiting lists at shelters. And what we're finding is that there's been a shift in the age group and the need. and the 21 to 24, which is year olds, which has been a big fight of ours, are largely the ones on waiting lists for up to 6 months sometimes.
Okay.
And young people under the age of 21 are on waiting lists for less than typically 24 hours. So there's a shift in understanding the age group and the how much this population is impacted and what else needs to be done for the older young adults that we work with.
Yeah. So the funding fight, as it were, maybe right now is most urgent at that 21-24 range. Correct.
I mean, there's a lot that happens to LGBT young people when they are forced out into the streets, when they're forced to run away. And a young person who's been homeless for, several months is at a greater disadvantage when they're in their young, in their early 20s than anyone else. Right. And there's a lot that we know with the Affordable Care Act and the provisions it made for younger adults under the age of 25, and we have responsibility to that population.
Right, right. I'd like to turn, I mean, this has really been such a difficult time for New York City and obviously the nation and the world. There have been times it seemed surreal, but I wondered if folks were willing to offer any insights about positive lessons that have come out of this. Perhaps services that you can offer remotely that you didn't realize the power of, or what you might have learned about your organization's resiliency in terms of being able to adapt under difficult times. Carmen, you're shaking your head.
Oh, we had quite a few positive lessons. We're going into our 11th year. We're actually in our 11th year. And to kick that off, we just instituted a new mission statement, which is about empowering our community to improve its physical, mental, and economic health and wellness. And we were planning post-Pride this year to start implementing the programming. So we are actually looking forward to that because we feel like we have a broader reach, given that we can do things digitally or virtually than we would have had if we needed to secure a space and be limited to that. So that's one thing that we are looking forward to doing as we continue to expand, just as part of our growth. The other thing is just the amazing creativity that we had, or not so much myself, but other members of the organization had with regard to figuring out how to translate our events into a virtual Pride and what we could do with the technology we have access to. So we are a little optimistic, even though it's very difficult to predict what Pride next year will look like. I doubt we will have in terms of the city's events, I doubt we'll have a large march, although there was a march this weekend. Social distancing was challenging for that march and other events, the protest as well. Right. But in terms of next year, who knows what we'll be facing. And so we do feel optimistic that we can embrace actually more technology and actually expand our reach in ways we never considered, because we can help provide access for the internet and/or equipment, and also just provide programming so that we perhaps can expand beyond Harlem, which we've been proudly representing, but it gives us an opportunity to explore that. So that's definitely a lesson for us.
Carmen, I'd like to flesh it out a little bit so our readers maybe can understand the context a bit. 3 or 4 years ago, I think you and I were both at a very lengthy meeting up in Harlem that the borough president was part of, Gail Brewer, and there was a lot of discussion there about the effort to build actually a community center up in Harlem for the LGBTQ community. When you talk about being able to do outreach via the internet for certain kinds of services, are you talking there about doing some of the things that this sort of longer term project to build an actual center would be doing?
Well, actually, there is some overlap.
Okay.
The center itself is its own 501c3 nonprofit separate from Harlem Pride. Right. And there's actually a coalition that is tasked with determining what programs and activities happen within that center. And right now, we're just waiting to do the foundation and break the ground so that the building can actually be built. COVID has stopped that or slowed that process a bit. So we're definitely looking forward to that in the next 3 to 4 years, I believe. Is the timeline now. It kind of keeps moving, but it's on track still. I've had to learn to have more patience. But to answer your question, yes, some of those things via Harlem Pride and perhaps the coalition as well, we'll be able to offer virtually. One of the programs that we've actually received funding for is an entrepreneurship program. That's one of our focuses where we have economic health and wellness. We have a two-pronged approach in personal finance as well as entrepreneurship. So both of those have been underway. We've been partnering with TD Bank for the personal finance, and we're partnering with a local CPA for the entrepreneurship piece. And that can be much broader than we initially anticipated and planned for, given that we can hold that via virtual programming. So I think it does overlap, and it will provide us with much more flexibility in what the center actually does, because all the organizations are somewhat intertwined. Some of the same people are involved, whereas one might not be involved in this one, but there's, you know, it's very concentric here in Harlem.
Right.
So, sure.
Is there a location on that center at this point yet?
Oh, yeah, it's on West 124th between Adam Clayton and Frederick Douglass.
Right.
So the building that was there already has been torn down. The ground is ready. We just need to be able to get the permits and stuff going so that we can go ahead and set the foundation and actually start building.
Okay. Sean, what kind of positive lessons or future directions do you see up Destination Tomorrow based on the last 3 or 4 months?
Positive is that corporations and foundations will give once they understand who you are and what your mission is, and that you have to ask. I think with us being a smaller organization, I like to say boutique, with us being a boutique organization, I think our biggest apprehension was like asking folks for money, right? I'm a Black trans guy, and here I am with my hand out. So I've always had an issue of asking. And I think what COVID showed me was because my mouth was closed, I wasn't getting what I needed, so that there are folks out there that are willing to help. Another lesson learned was the importance of funding diversity, right? To make sure that all of our eggs are not in one basket, like my grandma used to say. So now we're looking to the government, we're looking to corporations, we're looking to foundations, and we must begin an aggressive individual donor search or donor base. And the magic of the internet, right? Like my staff and I have always understood how powerful the internet was and how powerful social media was, but being able to like really connect on that level with our clients and still be able to extend what we consider the same level of care and competence was incredible, and we want to kind of build on that. And then lastly, it showed us that while we didn't get a lot of guidance from the city on our new housing initiative, because we're doing housing for sex workers, both current and former, who are 25 and older, right? Trans and gender nonconforming sex workers, 25 and older. And we didn't get a lot of guidance from the city or the government officials on how to open it safely. We have been able to put our own protocols and policies in place based on the picking and choosing what policies in place have come down from government sources. And we are happy to announce that we will be recruiting. We have 32 beds, so we're going to start filling those beds immediately. So I'm incredibly hopeful that we'll be able to get that up and running within the next couple of weeks, and that we'll get the support we need to sustain it.
So you've got that location is all set then?
2134 Barnes Avenue.
Gotcha.
Yeah, and we have, not only do we have the housing units, but we also have 3,500 square feet of retail space that now we're really going to look to rent out to someone. And we have 5,000 square feet of community space as well. And we're looking to try to figure out what we can do that'll continue to engage community, but can help us along a little bit too, as far as filling in the gaps with the budget.
Right, Emmett. In terms of the volunteer support you found, is there ways you can build on that going forward to because you have such an enormous volunteer need over time?
Yeah, I mean, I like I've said, we've been so fortunate to welcome so many new folks in, and now we have folks, with time who are longtime folks and they're coming back, and we're figuring out how to socially distance and work with all of these people. I think we're just going to have to figure out how we, what shifts do we need to add? What shifts do we need to continue to reconfigure so that we can work with all of the people who are really giving so much time and energy to God's love. It's an exciting challenge to have, and we're
When you
really
have
grateful.
volunteers, you don't want to lose them.
Exactly.
Floyd, any final thoughts on positives or things you've learned that you can apply later?
One big one is, Ineke was referencing this earlier, was mental health and trauma. It's sort of a lesson connected to COVID, but we know it's going to be a big challenge, and I'm excited to share that we'll be opening what I think is going to be the only LGBTQ plus mental health clinic at the Bedford Union Armory when we open up our state-of-the-art headquarters there. It'll be operated by Callan Lord, and have 3 private counseling offices and 1 group office there. So I think that's one thing that I'm very excited about in terms of a sort of a lesson and opportunity. And another that sort of harkens back to this idea, this lesson learned, is that I think the internet has dissolved many programmatic boundaries. In other words, you can now attend an AA group in Philadelphia if you don't like the one in the Bronx, or if you don't like one in Brooklyn. And I think that's both an opportunity and a cautionary tale, because I think that as these boundaries dissolve, we're all going to have to figure out how to develop collaborative programming, especially as the funding universe begins to shrink, and think more strategically about impact giving.
Okay. Ineke, what kinds of, I guess, directions and strategic issues should we look to Movement Advancement Project on in the next 6 to 12 months in terms of adapting to what we've gone through?
Yeah, we're doing a number of pieces of work. We're actually doing a more in-depth community center survey that will be published by the end of the year. And we're digging in both on how community centers are responding to COVID and what innovations and programming they have, so we can publish some of those stories and release them and kind of see how this is looking differently across the country, because it really does look different depending on the size of the center, where they are geographically, who their supporters are. We also publish what we call standard annual reporting. It's kind of a look at the advocacy organizations in the movement. They are struggling very differently. They don't have to work around the lack of direct service provision, because they're not in the business of that. But how do you lobby in a time where you can't go into a politician's office and have a face-to-face conversation? So they're trying to figure out things like, are they ever going to open their offices back up, or are they going to have limited office space, and what positions can be remote? And so I think we're going to see a lot of innovation in other ways too. Movement Advancement Project, we've always been a remote team, and that allows us to hire people from all sorts of areas of the country. And I think, our advocacy organizations, they're starting to find that too. Like, there might be great talent in Iowa that they never thought they could hire, and now they can. So we're also doing some work with an ED coalition. We have a chief financial officer, CFO type coalition and meeting that we do every year. So we're trying to provide some support there as people look at, how and where can they cut costs, what government loan programs might be coming up. So we're working across those various areas, but in terms of things that we'll publish, you can look forward to the community center report and then the LGBT advocacy report.
That's great. I always over the years find there's a lot of insight in your reports, and things that I learn about sort of step back from the day-to-day things here in New York and step back and see what's going on overall. I think this is a wonderful way to close out Pride Month. I think this discussion and the work that all of you do is, you know, is really pride. And so I'm very proud. Carmen, Floyd, Inika, Emmett, Sean, Alex, thank you all so much. I also want to thank our sponsors, Metro Plus, AARP, New York City, Aperture Community Health Center, New York City Health and Hospitals, Kings County, and the AIDS Healthcare Foundation. And the last thing is, if you all go out this evening after this webinar, get some fresh air, maybe eat at one of the outdoor dining spots, wear your mask. We're all in this together. Thank you so much.
Thank you, Paul.
And
Thanks so much, everyone.
Thank you once again on behalf of Schneps Media and Gay City News. Thank you for attending. Thank you to our incredible panelists who are doing such wonderful work. And I want to thank one more time our sponsors for making this possible. Metro Health Plus, AARP New York City Health and Hospitals, King County, Aperture Community Health Center, and AIDS Healthcare Foundation. Everyone stay safe and be well.
Bye-bye.
Thank you all.
Wear your mask.